So this video is about this client who has a very small dorsal bump, and we are going to fix it with a 1 point technique using a cannula by our trainee. And of course you need to have experience using a cannula elsewhere on the face, because that will make it much easier.
The bump she's talking
So
about
just
is on her
analyze
left
the
side.
nose. Basically,
So
you're filling in the
maybe
dips. There's a
fill
bump,
that
and you
little
want
bit
to cover the
after, so
bump with
that's
a little bit of
on that
filler
on that
above
side.
and below the bump. And this
And
volume loss on the lateral side
straighten
of
up
the
a bit.
nose, so you might, if you can put the cannula there easily,
Doing okay, Paulina?
which means that it goes there
Just massage
without
the
too
nose
much
point a bit.
resistance, then put a little bit of filler there.
Just 1, 2, 3.
Let's start with the insertion point. So just getting the cannula in the skin is sometimes the hardest part, because the skin here is quite tough, a lot of collagen and elastin, and under the skin you have quite a bit of fibrous tissue and resistance. In my training sessions, I notice that most of the time I am teaching people or helping them get into the skin once they made the insertion point. And once it's in, they kind of know what to do, because literally there's not much else to do once you're under the skin there. I mean, keep in mind the cannula will not go in the dermis, right? It has to go under the skin. So, and it won't go in the bone either, because it's very difficult to make the insertion point tunnel entry so perfect that you get to that fascia layer. So don't worry too much about the depth.
Couple of millimeters only, not centimeter.
So I usually make my entry point on the highest point of the bump, because then you can proceed superiorly and inferiorly on the nose from that easily. But you make sure that you don't inject any filler around the dorsal bump.
Give it a little massage there, from the top, the side.
In some way, I think we're kind of done here. I mean, the rest is just polishing, fine tuning, and you can really spend a lot of time on the nose. But sometimes that's all the client wanted.
I'm gonna put it more on the left side of the window. Yeah, right there.
A bolus, or would
Yeah.
you do it like a thread?
A bolus. It's a small space.
Okay, good.
Put 0.05 there.
Good. Let me just see how that looks first. Yeah, massage it now.
And massaging the filler is very important here. I spend probably more time massaging than injecting, and that is because the massage is your opportunity to spread it, migrate it along the areas where you want the skin to raise. So for completion's sake, we'll also put filler below the bump, and you can see that it's difficult putting the cannula and flipping it around. It has to be flipped around because you can only put the cannula in the direction the initial insertion point was made. That's a halfway flip that will do the job, because that's the area of concern. And you can see some mild blanching happening. That's because the tip of the cannula is quite close to the skin, and that's fine, you know. But as you become more experienced, you'll probably not do that. That way you probably not put the cannula so close or against the skin so firmly. That's totally fine though.
Top, very, very top like this. Because you want to squeeze the swelling out and see what the nose looks like when there's less swelling. Exactly. Yeah, that bit, just massage that top bit a bit more there. Maybe looking straight.
So here's her results. I mean, this is not the final result. Obviously, there's some swelling over the nose that will settle. But this is your 1 point nose job. And Yeah, majority of the noses can be treated this way.
Good. And back a little bit faster. All the way. Perfect.